But remind me to talk a little bit about salaries and life choices with this graph at the end of my talk. So here's the graph. Here's the life graph. And roughly here. Okay, these are dollars. So anyways, I'll get to that in a second. I have a similar life history to a number of the people here. Unlike Dr. Dietrich, I had more like Hoffman and Pia. I still to this day don't know why I went into what I went into exactly. I was at a privileged liberal arts college in, oh, by the way, I'm a visiting professor here. I don't know whether I'm a senior lecturer at the University of California, and I don't know my title here, but I'm half-time here. But I want to emphasize that somewhere around my third year in college, I was in a haze of psychedelics and things like that, and I was sort of trying to decide whether I was going to be pre-med or a psych major, and I took a number of courses that were emphasizing development, both in biology and in psychology, and I decided that I was really interested in child development. If the major at the time, I think I'm the oldest speaker here, had existed, developmental neurobiology, that's probably what I would have gone into. But I, as an undergrad, was both pre-med and psychology, like a few people here. But that was more of an expression of indecision than it was an expression of, I want to get high GPAs. I was, at the end of my 4 years of college, I knew I wanted to do either pediatrics and go to medical school, or I wanted to do something in the broader area of child development. And I was accepted at a number. It was much easier to get into grad school in those days. I was accepted at a number of schools in psychology in child development. In those days, if you wanted to study child development, you didn't have a lot of different types of departments or different disciplines that studied child development. You really had two choices, which was doctoral level applied research in education, pediatrics and medicine, or a PhD in psychology. What I really wanted was a PhD in child development. And so I went with the psychology realm, and I also went to a grad school that was in the place I wanted to be. I made some pretty idiosyncratic decisions. It was a nice place to live, so I thought I'd have a good time there. But like Zahra, I got to read and read and read for four and a half years in graduate school, and I loved it. What I discovered rather quickly was that child development is not psychology, child development is not pediatrics, child development is not developmental neurobiology. I was able in the library, we had to go to the library in those days. We didn't know what the internet was, so we had to walk across the campus and check out books and journals and read them. But anyways, I rapidly, as a doctoral student, became a broad-based studier and researcher in broad-based cross-sectional issues in child development. So although my PhD is in psychology, and specifically I worked in both clinical child psychology and in child development in general, my interest was, what I guess we would say now, was promoting the well-being of children, both from a psychosocial perspective, but even from a public health and health perspective. Another thing that doesn't exist now to my knowledge is I got an APA after I got my doctorate, which was in applied areas of clinical psychology. I was analyzing and working in a research team that was doing work with conduct problem boys. I got a medical internship in psychology. I don't know if these exist anymore. In a child guidance clinic with Washington University Medical School in St. Louis. And I had this terrible experience. My supervisors required us to do medical rotations, and there were people there that found out that I was really interested in pediatric psychology and becoming a pediatric psychologist. The other interns weren't that interested in it, so I think it was the third week of my internship, I was assigned the clinical case of an adolescent who was dying. And it was the most difficult work of my life, and it was also my most life-forming for me, because after that I found my passion, which is working at a very low rate of reinforcement work with children that have live in severe circumstances of poverty, disease, and conflict and all of those bad circumstances that I think many of you know I have worked with. There was also this epidemic that was beginning of disease at the time. Again, I'm much older than the other speakers, called HIV in the United States of America. And at the time, everybody believed that HIV was a disease of adult males. I started getting work and doing work with children and with HIV and heterosexual couples who were parents who had HIV, and they had to work with the issue of their children. So I quickly became a family therapist and worked with families, but I always had both feet in the field of applied research with children in extreme circumstances, and particularly medical circumstances, and being a clinician. I got a great postdoc at the University of Oregon. I got another postdoc at the University of Washington. I had a 6-month break between postdocs, met a young, lovely woman at the University of California, Berkeley, who was graduating from law school, and she said to me, "We're not taking those postdocs. We're moving to Santa Cruz, California." So here's the next thing that I like with Haitham and Pia's thing is I said, okay, that means I'm not doing research. There's no medical research facilities there. I'm going to have to go into clinical and school psychology. And I was willing to do it. I changed careers completely, elite career path completely. And that was, I just want to emphasize the flexibility and willingness to change career paths that you all should have, even if you get into some of these great schools. So I called up a few people. I finished up my clinical licensing. I worked a bit as a school psychologist and worked with pediatricians in my local community as a clinical psychologist. For about 15 to 20 years, I worked pretty much nonstop as a clinical psychologist. Mainly, my main referral source were special education departments, so I was working with disabled children, and then mainly pediatricians. So again, I was working with HIV, I was working with chronic illness, I was working with families that were dealing with poverty and chronic illness. And it was a very rewarding career. I loved it, but I kept getting calls from the University of California to come and teach one course here, teach one course there. And eventually I segued into being a lecturer at the University of California at Santa Cruz there. I loved my clinical work. I didn't stop it until the following event occurred, and I want to emphasize this to those of you who are thinking of going into clinical psych. Okay, so my wife is a business lawyer. She and I started at zero income just before our 30th birthdays because we had just gotten out of graduate school. And I had my clinical licensing all completed. I had great referral sources. By the way, my clinical practice was full within about a year of opening up an office. And so my salary when we first moved together went like this in about a period of 2 years. I'm not going to tell you what these exact numbers are. They were good numbers. And I thought the future is great. You've got to wear shades. My wife had struggled because she was new to the business community and was having a really hard time getting going. But something you all need to know about is psychologists tend to charge, the clinical psychologists tend to charge at a consistent rate. And by the way, the child psychologists get paid the least. We don't, because we work with people that don't have as much disposable income. And so although my income had gone up rapidly, after about 2 years it did this. And this is due to the factors of managed care, health insurance companies, and frankly, just what everybody's paying. That's her, and this is me. So you can see that my macho-ness was problematic here. I mean, with this, I just want to emphasize this to people, that actually my income towards the end of my clinical practice was actually worth less than it was here because of cost of living. It was a very frustrating situation, but that's how I did my next career choice. was that I realized I need to do some more teaching, I need to do some more consulting, and I'd always been interested in doing consulting and or work in from a cross-cultural perspective of working with children in extreme circumstances. So roughly at the age of about 50, I started doing consultations for international NGOs and for international psychological, no, more like 45, international agencies that wanted to apply Western knowledge and data analysis to what we can do with in developing nations. So I started doing what is called desk review research and M&E research for NGOs like UNICEF, Save the Children, Christian Children's Fund, and eventually started actually doing on-site work in Africa, Latin America, to evaluate intervention programs for children with HIV, children in poverty, and also my interest rapidly moved over to children in war-affected situations, which is how I got to Lebanon. No other reason, actually. I became an Africa expert, and when I found out about the job at AUB and Tima interviewed me, I said, I'm not a Middle East expert. I don't know if I should really be here. I ended up here anyway. I closed my private practice in about, after a few years of that work, because I was out of the country so much that I was really neglecting my clients.